Capitol Report is a production of Senate Media Services.
On this week's program, policymakers are hoping to help those Minnesotans facing steep health insurance hikes, plus a glimpse into important economic factors impacting the state budget. Stay tuned for this and more on this week's Capitol Report. Here at the Capitol, lawmakers have turned their attention to addressing the problem of rising health care insurance premiums in the individual market. Lawmakers from both political parties are actively discussing possible actions and solutions to help those Minnesotans who are facing rising insurance rates.
I have the potential of spending $37,000 on health care in 2017. What business, family, individual, farmer, or rational person can pay 50 to 60% of their income for health costs? I mean, what am I going to do? I can't go without anything. I've cut back as far as I can. My only option is to burn through my life savings and not to retire in the near future.
The options we have are to switch or stay with a Health Partners plan with their peak network, which doesn't include any of the doctors that we visited for years. That would limit our increase in premiums to only 40%. Or we can switch back to Blue Cross and their Allina HMO network. That means we're staring at a 70% increase in premiums. So based on that, next year we'd be spending more than $1,200 a month in premiums with a $13,000 deductible. And it's not only about the crazy nature of the cost, it's also about access, because even under Blue Cross, this is a very limited network. It's very hard to get referrals to specialists under this network. So we're going to be paying a gigantic amount of money for sort of substandard insurance at this point.
The reality is the Affordable Care Act is no longer affordable to increasing numbers of people. And Congress, which has been totally deadlocked in terms of making any necessary changes or improvements, is going to have to step into this in January with the next administration and make the kind of changes such as if we had a level of reinsurance is called, but insurance by the public sector, by the federal government for catastrophic health care occurrences, you'd bring the rates down very significantly.
Oftentimes you hear people saying that it's the MNsure, or the Minnesota Insurance Exchange, that is driving this problem. The Minnesota Insurance Exchange is simply a website upon which people can shop and compare. To say that MNsure is driving the cost of health care would be the same as saying that the website for buying airline tickets is driving the cost of airline tickets. The airlines are driving the cost of the airline tickets. They're setting the prices and selling them on the website. The insurance companies are saying what they need for you to buy that health insurance product and offering it on MNsure.
Even if we were able to get tax credits for those people eligible for the tax credits that to flow for off-exchange purchases, it still wouldn't help the group that we're talking about that are above the 400% threshold and just ineligible for taxes regardless. That's the folks that are really exposed and that we really need to pay, to keep our focus on. So if you're under that 400%, you do have an avenue to gain access to the subsidies to buy down the monthly cost of your premiums. If you're above that threshold, we take it seriously. We need to focus on that set of individuals and really try to provide that financial assistance.
Today, the uncompensated care is higher. Why? Not because people don't have health insurance, because they can't afford their deductible. So we can't pretend like more Minnesotans have coverage today, because $13,000 deductibles are not health coverage. Minnesota families cannot afford that. We need help from Minnesotans. And it isn't throwing more money at a failing system. How is putting more money or just simply paying the bills that Minnesotans are faced with now going to allow the 130,000 people that will be without health coverage on January 1st to get coverage? It doesn't solve that problem. And not to mention the dozens of people that I have talked to in the last 3 days that are being thrown out of their plan and thus out of their network, and they can't see their doctor that they've seen for years. that's a problem. And none of those Band-Aid solutions do anything to solve that. Now, we may need to do Band-Aid solutions, so don't misconstrue what I'm saying as being critical of that. Yeah, we do, but we can't just do a Band-Aid.
I can tell you, and I'm sure my colleagues would agree, that there is no issue that I hear more about at the doors when we're door knocking and in our legislative offices than the issue of health care. People who say literally, I don't know what to do. I've lost my coverage. I can't afford it. What are my options? The MNsure exchange doesn't work. We hear these things constantly.
Many of you remember MSHA, the risk pool. It probably needs to come back in a modified version, but how reasonable to bring back something that was working in Minnesota and move that idea forward as a real solution for Minnesota families. How about tax deductibility for health insurance premiums? Employers can deduct the insurance that they provide to their employees, so why can't an individual starting a business deduct their insurance?
Our concern is the Democrats in the Senate continues to be, as it has been in the last 2 years, the stabilization of the individual market, because the rest of the market has really, under the Affordable Care Act, stabilized and provided so many positive benefits to Minnesotans.
5% of Minnesotans purchase health insurance on the individual market. In late September, the Department of Commerce announced that premiums would increase by more than 50% as insurers seek to align premium revenues with expected claims costs. The Senate DFL caucus is requesting that Governor Dayton call a special session to pass legislation to help relieve the financial burden imposed by these new rates. Joining me now in the studio is Deputy Majority Leader Senator Jeff Hayden. Thanks for being here. Hi.
Good to see you again.
So let's start with Governor Dayton calling a special session. Ideally, when would this occur? And what would be your goal? What would you like accomplished?
So we, want to call a special session. The governor could call us in as soon as this weekend. I think it's doubtful because we're so close to the election. But just as soon as we can kind of sit down and kind of figure out what we agree upon, we'd like to call a special session as soon as possible.
Okay, and one of the goals is to provide relief for those folks experiencing these huge premium increases. Open enrollment begins on November 1st. It ends December 15th. Their premiums are due before the new year. Is there time to help these people?
Yeah, I absolutely think there is. The premium or the ideas that we want to help people with their premiums, they can sign up for whatever the options are that they have available to them. At that point, they're going to get, kind of like, here's what the expected cost would be. What we would want to do is to put together some funding mechanism very similar to those that are going through the exchange today that would buy down the cost of their premiums.
Okay, so that's a short-term solution. Anything else you want to add to that before we talk about long-term solutions?
Well, I just think that it doesn't always deal with the access issue, and we are working on that issue. We know that a major carrier, Blue Cross Blue Shield, pulled out and really created this access issue and affordability issue. So the immediate and short-term solution is to deal with the affordability. We know that every single Minnesotan will have access to health insurance, unlike what I think people have been hearing. It may not be the one that they want, and it may not be their preferred provider, but people will have access to that. Our first job is to try to buy down the cost for those percentage of folks that can't get tax credits through the exchange. Then we want to work on this issue on a more long-term level to figure out the access issue and to make sure that people have the opportunity to get the kind of health care that they want with the provider who they choose.
So one of the options that has been proposed by both the Commerce Commissioner and the GOP Senate is bringing back MSHA, or the Minnesota Comprehensive Health Association, which prior to the Affordable Care Act did provide insurance to this high-risk group. Is this a good option?
I think we would have to study that. I think the idea, now first of all, what's kind of driving the cost and even MSHA is this issue of pre-existing conditions. So nobody disagrees that we should give health care to people who have a pre-existing condition. The unintended consequence of that is that costs a lot more money, and we need to figure out what that group of people, who do we merge them with in order to cover the cost across the board so that one particular group doesn't have the skyrocketing premiums. So MCHA might be an option. I think another option would be to merge that individual market with maybe a small group market, or maybe we might do things like Minnesota Care for All, where people pay in at the level that they are. Some folks might not ever have to be subsidized, but they get into a marketplace where that they have more providers, they have more insurance providers, if you will. I think those are the kind of things that we'd like to look at, but everything should be on the table. And as a matter of fact, the Minnesota Senate DFL Healthcare Caucus, if you will, brought all of those things to conference committee, and the House GOP just chose not to look at that. So I think now everybody is kind of looking at this issue. It's front and center. There isn't a lot of things in the way. So I think that for us to come back with that healthcare task force, the governor's healthcare task force, take a look at all options on the table, and then figure out what would be best for Minnesotans as our best option.
Okay, and so how much of the ire should be directed at the actual health insurance companies who are raising rates and setting caps, and in some instances pulling out? How much ire should be directed at them?
Well, I want to be careful here. I think what I would say is we need to take a good look at the way that they do business. We need to take a good look at their actuarials. We don't need to necessarily just take their say for it.
Their word for it,
their word for it. We need to really kind of take a look at that. Often they're under projecting or over projecting. We need to figure that out. We need to also understand our relationship with them. The carriers also have a lot of the Medicaid business. They often have the self-insured business. They often have the state's business in terms of state employees. So we need to kind of take a look at that and make sure that they're not cherry picking kind of the business that they want, and that we're all kind of spreading out the risk, if you will, no pun intended, to take a look at it. So I don't want to blame them specifically, but I think that they are part of the issues that we're having here. They certainly can be part of the solutions, but we need to take a look comprehensively across the board at what's driving our healthcare costs.
Speaking of healthcare costs, pharmaceuticals are often pointed to one of the reasons why they're going up so incredibly. What's your thoughts on that?
Well, I think that we've had some bills to take a look at that issue. I think that pharmaceutical companies really need to be part of this discussion. I think, unfortunately, it becomes a market-driven process. We saw that with the EpiPen. We're seeing that with Nasoxone, in which we have an opioid crisis, and that's the antidote to opioids. I think we really do need to have a real discussion, making sure that pharmaceutical companies have the right amount of dollars that they need in order to do research and development and create new solutions and antidotes for things that we're looking at. But at the same time, they're not soaking the customer, our insurance companies, and thus Minnesotans and people around the country with unfair profits. So I think that they need to be part of the solution. But I think to just point the finger, that's the problem we've had, is everybody points the finger at each other. Now's the time, I think, now's the time to come together, everybody kind of put their cards on the table, recognize that the end user is the patient, the client, the citizen, and we need to have their best interest at heart while continuing to innovate, while continuing to make sure that these companies remain solvent, but at the same time, we're not shifting all the burden of the cost to the patient or the citizen.
So, in the sense that utilities are used by everybody and there's some regulation on that, healthcare is used by everybody, should there be some regulations just limiting profit margins on insurance companies?
Well, I think we should look at it. I mean, we're looking at, their reserves. We're looking at, kind of their profits. These are nonprofit companies. So we need to really kind of take a look at that. There's a whole bunch in statute that looks at that issue, and I think we should revisit that. But I want to be careful not to point the finger at one particular group. We're in this together. We got ourselves in this together. We can get ourselves out together.
Senator Hayden, we have to wrap it up, but thank you so much for coming today.
Thank you.
Many Minnesotans, even those not facing steep insurance premium increases this year, express anxiety about our healthcare system. Both parties are now calling for a special session to provide specific relief to Minnesotans who buy insurance on the individual market, but who do not qualify for subsidies. Joining me in the studio to provide a Senate Republican perspective on this crisis is Senator Jim Abeler. Welcome.
Thanks for having me.
So the whole point of insurance is to spread the risk.
Right.
And the individual market that we're talking about is 5%. Isn't that too small of a group to sufficiently spread risk?
Absolutely, and it used to be much larger, and we used to have a separate program called Mpls, which took care of the high risk, the high cost people who were very ill. And the people with the more normal amount of illness were in the side group. And now as this pool has gone away and the market has shrunk down, they're all landing in this small pool, and the rates are exploding.
Mm-hmm. And what would you propose to do about this?
Well, I'm trying to understand the policy of this, but there was a federal change and then some ways that we implemented the Affordable Care Act, Obamacare, and a lot of us thought it was a bad idea, and we were very concerned that this very thing would happen now. Mm-hmm. And so the big companies, the big insurance companies, big pharma, all were carved out, and all was left was the people in the small market that is now being crushed by just bad cooperation and bad implementation. And so you have to kind of go back a little bit and make things how they were. And so we need a way to take care of these high-cost individuals so they can get properly cared for, but not at the expense of a regular farmer or a Main Street hardware store owner.
Right.
And that has not happened, and now we have the crisis of rates going up 50 to 67%.
Yeah.
And it's making some of these folks functionally poor. And they used to be middle class. Like, what happened?
Mm-hmm. And you made the point recently that these are your neighbors and small business people that are really experiencing these double-digit increases. In addition, we've heard some testimony of these individuals and how their access to doctors is decreasing, and it's harder to get specialists. They're just running into problems with access to their health care. In addition, there's caps now. So what would you propose to do to kind of address some of this problem?
Well, there's two parts, and in the time we have, it's so short, but I'm really glad to take work at the tip of the iceberg here. There aren't enough plans. Minnesota has regulated the health industry so tightly that many have left over the years, and now we only have a handful of HMOs that cover. Hardly any of the regular insurance companies are here anymore. And so we've lost a lot of choice. And so that was kind of good. It made sense at the time. There were 8, and then now there's functionally about 3. And so now it's much more of a monopoly market, and there's not the competition there was. Farmers can't join into a group of farmers and buy their own insurance. The hardware store owners couldn't make a hardware association plan. Well, why not? You can't buy something from Iowa that you happen to like because it's been all constrained. So there's no competition. And also then, they've limited these networks to very few doctors. I have talked about this my entire time I've been in office, 17 years, that the only way you save money by limiting doctors is by denying proper care. And so the doctors, in their latest iterations, people can't go to the doctor they've gone to forever. Right. The original promise was you can keep your doctor, keep your plan, and it's going to be cheaper. None of those came true. And on the doctor part, you had to get a new doctor last time, and okay, I guess we know him too. The third one might be 30 miles away, you never met him. And the premiums are maybe $20,000, $25,000 for a $10,000 or more deductible. So you're looking at $30,000, $35,000 just to get in to start paying for it. This is catastrophic for these families, and that's why a lot of us are so concerned.
So, I mean, you've said that people should be able to create some co-ops or some other groups. Any other ideas for how we can help these people get access to healthcare, good access to healthcare? Right.
On the heart of this is this very complicated reinsurance. And so let's say I have some multiple sclerosis or something, I need a lot of care, maybe $300,000 a year. And the average person needs much less than $100,000. And so the old Mpls plan, which is an acronym that doesn't matter today, but this high-risk pool would have borne the extra cost of that. And we shared those amongst all the people that bought insurance. $168 million worth when it was last used. And that took a lot of the bite out of these high costs. And so maybe the insurance company would pay the first 100 and the second 200,000 would be paid for by another pool. That's reinsurance. And that way, the people who have normal amounts of illness and the people who are kind of sick, the rates stay affordable, which is sharing the risk, but not the highest risk. And that's where this has fallen apart. That's the complicated but really important thing to fix, this reinsurance.
Some Republicans are talking about eliminating MNsure and moving to the federal exchange. What is your position on that?
I've always liked the Minnesota version. I like things kept to home, and the feds, God bless the feds, but they're in Washington and they're so smart, they're too smart for us. I think still that we should try to rescue what we can out of the MNsure. It's only a place to buy a product. And so if you have a small pharmacy in Owatonna that's a locally owned one, or Walgreens or CVS, they still sell the same toilet paper and pharmaceuticals. So the products aren't going to change, it's just how they organize it. And MNsure has been a mess. And it could have been so much easier to use, and it still is clumsy. And there's improvements we can make. But I would like to make them on our terms. And frankly, I would like to make them in a bipartisan way. I have tried since the beginning of MNsure and the Affordable Care Act to work with people on the policy about this, to make it functional. And frankly, the one side has been dismissive. And a lot of us who meant to make it work better, because we live in the same towns they do, and we've been dismissed. And so a lot of us said, this is going to happen. Oh no, it's going to be amazing. It's going to be like Expedia. And it wasn't. And so it's time now for us to stop the politicizing. Stop it, just stop. Because your neighbors are getting crushed, and they're facing financial ruin, and they're facing becoming functionally poor while being a member of the middle class. And I think that is like not anything anybody wants to happen to them.
Senator Abeler, we're going to have to come back to this another time, but thank you so much for coming in today.
Thanks for having me.
Following the election, lawmakers will quickly turn their attention to Minnesota's economic and budget health. In late November, state officials must compile a budget forecast, which offers a long-term perspective on state revenues and expenditures. A key person who helps compile that information, state economist Dr. Kalambokidis, joins me in the studio. Welcome.
Thank you.
The latest state quarterly economic update indicated a couple of noteworthy items. One, that Minnesota revenues are slightly less than expected, and two, October estimates for growth of the GDP are slightly less than was forecast in February. So are these factors of slight, moderate, or major concern as you prepare the November budget forecast?
So one thing that's interesting about this is that when we start the forecast, we do look at where revenues are relative to our prior forecast, because what we're doing is we're updating the forecast from February to November, and we're looking at how the economy is moving. And sometimes those things move in opposite directions, where revenues are a little ahead, but the economy seems to be moving a little slowly, and vice versa. This time they're both moving in the same direction. So revenues are a little behind what we had forecast, and the U.S. economy is growing more slowly now than what had been expected in February. So those are just two things that are going to come into consideration as we start the November forecast.
Now, I know you can't get into any detail about the forecast, but are there areas of concern? Are there things that keep you up at night when you're preparing the forecast?
So one of the things that's a factor in the U.S. economy right now is that U.S. real GDP growth, or general U.S. economic growth, is moderate. So it's in the, right now for 2016, macro forecasters are expecting about 1.5% for this year. In the forecast, it gets to 2, a little less than 2, a little more than 2.
So there's growth, but it's pretty slow.
There's growth, but it's pretty slow.
Okay.
And that's okay, the economy can keep sort of doing that. But when growth is that slow, it means that if there is some kind of a shock to the economy, then there's not much margin for error. It doesn't take a big shock to push us into negative territory. And so we think a lot about what are those uncertainties and what are the possible sources of shocks.
What are some of those uncertainties, just generally?
Sure. Well, one of the things that has been influencing the U.S. economic growth over the last couple of years, well, two of the things are oil prices and global growth. So global growth has slowed. That's been a factor in the U.S. because when global growth is slow, that means that there's not as much of a demand for our exported goods. And that's been a factor in Minnesota too. So for Minnesota manufacturers and producers of commodities like corn and soybeans and iron ore, there isn't as much of a market for that. So watching global growth and shocks that could be geopolitical shocks that slow that further, that can be an issue. Oil prices have an impact on the U.S. economy because the U.S. U.S. is now an oil producing country, and so when oil prices are really low, that has reduced equipment investment, drilling and exploration activity in the U.S. And so watching those prices and watching the activities of other exporting countries to see are prices going to be supported or not.
So that's some of the international market trends. What are some of the domestic market trends that you look at to help shape your forecast?
Sure. So some of the things that are happening domestically are influenced by the global economy. For instance, slowdowns in manufacturing because of reduced global growth. We have had a couple of years now of very low agricultural commodity prices because agricultural production has been very efficient and effective, and so we've had really big crops, and so those prices have been low, and that's been a factor in farm incomes.
Are there any other trends? How does the Federal Reserve affect your forecasting?
Sure. So the Fed is in a position now where they've said that they want to return to a more normal monetary policy from this really long stretch of accommodative or easy money monetary policy. And so they've said they want to raise interest rates, but they'll do it based on what the economic numbers say. So is the economy moving well enough? Is inflation starting to increase? Are wages starting to increase? Then they can make that move. And so when that happens, that will affect markets because people will be looking for higher interest rates than what we had seen before. So that affects, of course, borrowers and lenders differently. So that's another source of uncertainty in the U.S. economy.
So in general, what areas of the economy have historically been volatile? Where's the most volatility?
So in the economy, volatility tends to be in commodity markets. So if you're a state that's depending a lot on oil prices, you're producing natural gas, looking at those,
like
prices,
North Dakota?
Like North Dakota,
Okay.
Then those kinds of things are very volatile, and it's kind of hard to run an economy that way because you have these big swings up and down. Agricultural commodity prices, I've mentioned, they can be volatile too. And so a state that has a significant part of their economy invested there can have some volatility. Historically, things like construction are volatile as well.
So like housing starts and how that industry is doing.
That's
okay. When you compile a budget forecast, how do you keep bias out of your estimations?
Well, I'm an economist, and the people who work with me, we have a couple of other talented economists who work with me, and so we do a lot of reminding ourselves to stay grounded in the economic theory and the data that we're looking at. So we need to do a lot of observation. We're looking at a lot of different kinds of data, U.S., global, and Minnesota-specific data. And when we start to hear, for instance, I do a lot of public speaking, and I'm out talking to groups. People ask me questions, and when they start asking me questions or making comments that seems inconsistent with the data I'm looking at, I kind of circle back and go back to the data, back to the theory, and say, okay, so what's missing here? Are these people talking about something that I've been missing in the data, or are they not seeing the bigger picture that we're looking at? So because we're doing a lot of collecting and observing of data, running of our models, reading papers, reading other people's work, I think we stay pretty grounded in the economics.
Dr. Kalambokidis, that's all we have time for today, but thanks so much for coming.
My pleasure.
Join us again next week as we delve into more topics affecting Minnesotans. I'm Shannon Loehrke, and on behalf of all of us at Senate Media Services, thanks for watching.